So we're going to take a look at the ODU Explorer on posterior teeth. So just like all instruments, first we have to decide where we want to sit, planar fulcrum, take the point of this instrument between the premolars because we can see that with direct vision and decide if it looks parallel with the long axis of the tooth. And this does look parallel with the long axis of the tooth. If we use the opposite side, we can see and put the point between the premolars. We can see how it looks very wrappy. And if we try to fix that, then our wrist starts to be a little bit crooked and our handle goes away from the midline. So we're going to go back to the correct end. We're going to start at the distal line angle and we're going to place it directly on the tooth. And we're going to make very small little overlapping strokes. And we're going to roll this instrument with our thumb and first finger. So make sure we're tucked in very nicely so we're always on the tooth. If you're always keeping the tip on the tooth, you will never cause tissue trauma to your patient. So after we're done with the distal, we're going to place this back on the distal line angle and we're going to have the tip on the tooth, of course. And we're going to make very small little overlapping strokes. We need lots of little overlapping strokes because if we make big strokes, we may miss a deposit. We always take this to the base of the pocket. And it doesn't take much pressure at all to insert it and to get to the base of the pocket. We never want to be heavy-handed with this. We'll lose our tactile sensitivity if we do. Once we get to this mesial line angle, we want to stand up on our fulcrum so we can stay parallel. If we don't stand up on our fulcrum, our instrument starts to look like this. And you can see how the terminal shank is not parallel with the long axis. And in fact, we are going to have tissue trauma to the sulcus area if we do that. So to have excellent instrumentation, you're going to need to stand up on your fulcrum right here and roll this instrument in your thumb and first finger so that you're tucking it in very well and you're staying parallel with the long axis and your tip is always on the tooth.